Welcome, ladies and gentlemen, to the Resilience Community of Interest session today, titled COVID-19 Co-op in the AE Community. I am Tamel Harbison with the national team at SAME, here to help in the background if you have any technical difficulties. Just a few housekeeping. We do ask that you mute your phones. You are in a listen-only mode as well. If you have any questions for the presenters at any time, we ask that you ask that in the questions tab on your control panel. This downloaded PDH certificate will be in the handout section, as well as the PDF version of the presentation today. We do have a few poll questions for today, so we ask that once it pops up onto your screen, just to make your selection quickly. And this webinar will be recorded. And now I'd like to turn it over to Jane Manick as our moderator for today.
Thank you, Tamel. Much appreciated. I'm Jane Manick, and I'm with CDM Smith. On behalf of Joe Manus and the SAME Resilience Community of Interest, I want to welcome everybody and welcome Mike Bichon and Gwen Baker. The format for today will be, we will have two 15 to 20 minute presentations followed by a moderated Q&A session that I will moderate. So as Tamel said, please type your questions in to the chat box, question box as we go along. This webinar is designed to have an open discussion of best practices that both the government entities and private sector AE firms have used and are continuing to use during the COVID restrictions so that they can continue to operate successfully and then transition successfully as restrictions are relaxed. We have a number of learning objectives I won't go over, but I appreciate everybody's time and your interest today. All right, the first poll. Please select one of the answers. We want to get an idea of the demographic of the folks on the phone. Active duty military, civilian agency, small business, large business, or academic institution or nonprofit. All right. How do we do, Tamel? So the vast majority of folks are from small businesses. Fantastic. Followed by large businesses and then government agencies, followed with a small group from active duty military and nonprofits. Great combination. So that gives us a good idea of who's on the phone. And by the way, we have over 100 attendees, which is another fantastic milestone. Let me introduce our speakers. So Gwen Baker is the Senior Vice President of the Federal Services Unit for CDM Smith. And as that unit leader, she is in charge of business development and strategy for the U.S. government sector of CDM Smith. That includes business clients in DOD, Energy, EPA, Bureau of Reclamation, many others, from Sub-Saharan Africa, the Middle East, through Europe and North America. Ms. Baker is a graduate of West Point, and she served for many years in the U.S. Army Corps of Engineers. And in that role, she was in charge of government contracts totaling more than $500 million, including programs related to flood control, flood hazard mapping, navigation, water supply, and ecosystem restoration. Her 22-year career is something that Mike Bichon overlapped with. Mike Bichon is our government speaker from the New England District of the Army Corps of Engineers. Mike has been with the New England District since May 2012. And prior to that, he was with CDM Smith for 12 years. He is a professional engineer. And during his time with CDM Smith, he worked internationally and in the U.S. Mike at the Corps is the Levee Safety Program Manager In addition, Mike has done several developmental assignments as the chief of the geotechnical section. And during his Norfolk district days, he was part of the executive leadership development program and spent a fair amount of time at the Arlington National Cemetery. And this past in January 2018, a couple of years ago, Mike was selected as chief of the geotechnical water resources branch with the New England district. Mike's got a love for coaching, and he's got a number of handyman videos and handyman tasks that we could ask him about later on. And my fun fact about Gwen is that she's made more than 50 jumps out of airplanes in her active duty military time. So we could talk about that later on too. All right, I think we'll hand it over to Mike Bouchon to start his presentation. Thanks, Mike.
Thanks, Jay. Let me just see if I've got control here. Oh, all right. So, good afternoon, everybody. Thanks for joining us. I appreciate the interest and also really look forward to Gwen's presentation as well as the dialogue. I think everybody can appreciate that these are unique times, but in these unique times, I think it's a good opportunity to reassess how we've been operating. And, you know, I think like everybody here, we've been impacted both on a personal and professional level, but I've been amazed at the response from just about everybody, how as individuals, professionals, and it doesn't matter where you sit in that professional world, how we've kind of responded to this challenge. So what I'm going to do is kind of share a little bit of our perspective at the New England district, how we responded. And I'll sort of break those down into three areas. First, I'll talk a little bit about our response during COVID. What we did, what actions we took. Then I'll talk a little bit about how we are attempting to return back to the office and sort of return back to what I'll say now was sort of the old way of doing things. And then, you know, even though we're still not out of the woods, I think there's a lot of lessons learned here. Kind of talk a little bit about what I see as the future, certainly for the New England district, but also as the core as a whole. I think you'll see some changes come out of this as a result of, you know, this experience. Okay, so our response during COVID. One of the unique things, and Gwen can appreciate this, is that as an organization that's nested under the Department of Defense, doing COOP exercises is something that we do on a routine basis. So the Corps actually does COOP exercises. I forget now, we usually do it quarterly or semi-annually, and those will usually vary to just call down, make sure our call down lists are active and accurate. And it's really just to get a hold of someone. We'll get an email from our commander saying, hey, COOP exercise, please make sure you can get a hold of everyone in your responsibility chain in the next couple of hours. So the reason I bring that up here is one of the lessons we learned from that is some people didn't have accessibility to spreadsheets that were located on a server. So as a result, and this is kind of foreshadowing what I'll tell you is one of our challenges, is that we had all our supervisors have a call down list on their PC. So they didn't actually have to be connected to our infrastructure network in order to be able to reach folks. That was extremely important, certainly in the first week of COVID for us. The next one is telework agreements for all. And I think folks, you know, we've got a range of folks there from across the community, but you'll see certainly within the core, telework has been something that we've embraced the concept of, maybe not wholeheartedly in practice. It's been a little bit of a challenge because we are an organization that does a lot of face-to-face meetings. We're in a team environment, and there was a lot of emphasis put on having that face-to-face interaction. And so prior to COVID, telework was not something everyone had in place. And so a couple of weeks before we went into a max telework agreement, we saw the writing on the wall and actually made sure that everyone could get telework agreements legally in place. And the legally in place was not as important as it was that it allowed people to start prepping for what telework might be, and that they would have to prepare for being out of the office. That was sort of one of the big things for us that helped kind of set the stage. So then shifting, we actually had on March 13th, I remember the day explicitly, we went into a max telework environment. There was a concern that we may have a potential COVID result that may have come into the office. So we immediately went into a max telework environment. And so that dramatically shifted how we did work from that day forward. So the thing we learned, and that I think we've known from previous disasters, emergency situations, is you got to have clear and concise messaging. From day one, the day we sent people home, we said, guys, listen, the first message that went out, we have an emergency ad hoc system, said, we want to protect people. So as a precaution, we want everyone to stay home and be prepared to work remotely. And we told them our priorities are two things. First is we want to protect the people, because without the people, you can't execute anything. So that was our first and foremost priority, is we want to protect the people. And that message is all the way through what we do today. And the second part, though, is we still have to execute the mission. Like everybody, the core cannot just shut down. We have not only that, even if we could delay projects and not have people come in, we have dams that need to be monitored because the weather doesn't stop because of a pandemic. We have the Cape Cod Canal within our AOR that needs marine traffic controllers. So what we ended up doing is having to triage all of our mission areas. So what we did is we got a very quick conference call with all of the department heads, and we started talking about the key things that must stay open, and we must have people in direct contact with each other in order to execute it. And then really the next thing we did is kind of limit the number of those people that actually had to go, and we kind of pared that back. We bought ourselves a couple of weeks so that we could allow those must-have things to operate while we figured out how to navigate this new world. But doing so, we made it abundantly clear to people that from day one, if they had conflicts, that they would end up, we would work around them. And by going to max telework, many of you probably are aware that, you know, the core has core hours. We expanded those core hours. I think it expanded to like start at 5 a.m. and end at 9 p.m. During this max telework. But we also had there the unspoken rule that if people needed to work outside of that, it was perfectly fine. You just don't put that on the timesheet because of the way that we have to do our counting. But it was understandable and supported from the very top. So that was really important. I think that helped at least start to alleviate some people's concerns about how we would operate. The next part, though, gets to sort of the messaging. So what we put up here is we created a COVID-19 website on our intranet, so our internally facing page, that allowed people to keep up to date with what was going on, how the district was responding. And we created, we put up there our responsible return plan. We had travel guidance because as many states came out with restrictions, we had to navigate what that meant to us, what that meant to our mission, how our people could travel and do it safely. We provided up there telework guidance. You can see the tab. We had a whole document library. And then also just a lot of support services. What we found is the social and emotional impact of this was quite substantial. So we made sure people had on their assistance programs, numbers to call if they were concerned. But I felt this website was really important for us because it did a great job of getting a consistent message out there and allowing people to see the changes. And we have a pretty large area of responsibility. You can see at the bottom, we kept track of how all the states were handling this. So to us, that was really important to let people know what we were doing to kind of protect them going forward. So the next part, I kind of hit on this. The first week for the core was just not good. There's no good way of saying that. We had a VPN capability, I believe, that was able to handle about 10,000 people working remotely. And in a matter of about 2 days, you had over 33,000 people trying to access that. The first week was debilitating. But to the credit of the core and quite frankly, our IT folks over the weekend, they upgraded our VPN capability so that basically from the second week on, we've almost had a seamless infrastructure that's allowed all 33,000 people to operate remotely. Without that big change, we wouldn't be here today. We'd be back into the office because we just couldn't operate like that. It was a challenge. The East Coast folks knew when the West Coast folks would come online because the network connectivity would go way down. The next one is, so we actually allowed people, and it gets back to that pre-telework, we allowed people to take equipment home. We knew this was going to be sort of a long haul, and so we asked people to take monitors, chairs, some even did the Vera desks, basically to make their home office like home. We said, hey, we expect that this is going to be out there for some time, make yourself comfortable. And you know, the core and the government has an accountability sheet for every piece of equipment that we own, and that's been a challenge, but we told the folks, don't worry about that part of it, make yourself comfortable. So, you know, again, this highlights all the things that I thought were important to me, whereas, you know, the government's got a lot of black and white restrictions, but in the time of need, I think we acknowledge what's most important, and we're able to kind of work through them. We also did daily check-ins. This is something that I think we learned that folks probably take for granted, the day-to-day, hey, how's it going, walking by someone and saying hello. Some people were a little bit isolated, either living alone, didn't have a lot of social interaction. So we made it a point that have every first line supervisor had to talk with their employee or at least get an email from them on a daily basis, just what their hours of operation would be, and just to see if they were doing okay and health-wise. So that happened for the first basically 2 months of our max telework agreement. It was a lot, I think, on first line supervisors, but I think it was definitely needed to make sure we maintain that connection with people. The other thing we did is social interactions. And what I mean by that is we set up, again, you can only do so much with social distancing, but we made it a point to do so I'll take within my branch, and I know other branches did it, we did weekly social hours. So Thursday afternoon, we would get a group on and we would actually play either web games. We could have a cold beverage since all the people were off hours. We would do categories. we all did this. We did trivia night. We had different themes every week, and we're still doing it today. One of the best things that we did was encourage and ask all our supervisors to set up at least one social hour every 2 weeks with their staff, because we felt people didn't have an outlet for that, and at least provided and allowed folks to stay connected. So that was one of the good things we did. Again, it was still virtually, but I think it was greatly appreciated. And then I think, like everyone, we used, collaboration tools, WebEx, Skype. We have a Microsoft Teams. With the Corps and the government, there's only so much we can use on our government computers, but we're able to use some of these tools to have this, video or face-to-face dialogue. Okay, so what did we do to get back? The first thing is we surveyed the workforce, right? Our workforce, like everyone, was really concerned about what back to work would look like. It was pretty much a shock to the system that, on March 12th, everything was okay. On March 13th, it was a different way of doing business. So we sent out a survey asking people, about PPE, how they would feel about it, temperature screening. We actually required that on our first phase. And so we wanted to know whether people felt comfortable doing that at the door by themselves. Cloth coverings are a way of the norm now, and so we require that in our office. We asked people about, their input, if they wanted it provided. And then really we looked at asking people to fall into which categories did they fall at. And we're trying to gauge at how many people might be impacted and could physically return to work if we're able to address it. The biggest thing I felt that this survey did is it allowed people to have their voices heard and had some input into the plan. And that's one of the things that I think has gone a long way with sort of our workforce, is just being able to have their concerns heard and feel like they've been accommodated. We can't accommodate everybody. You can see the scatter in the data, but I think that, allowing them to voice those, I think, helps. All right, and so then we just developed a responsible return to the office plan. We never technically left, since someone was always in there, but it was important to develop a plan. And what you'll see is that we at the Corps and all of the state's restrictions, pretty much every one of them had some type of exemption for the Corps' mission. And so we didn't directly fall under any state requirement, but it was important for us to let our staff know, and because we also have a broad geographic area that not one state could cover it all. So we had our own plan, and it was really a plan that was nested with the CDC's requirements, but we developed 4 phases based off of percent occupancy of the building. And those are ceilings. As we sit here today, on June 8th, we moved to phase 2, which is 50%. I can tell you there is nowhere near 50% in our building. We're probably still under 20% in the building, and that's okay. We plan to stay at phase 2 for quite some time now, just to gauge how it's going. But we did put this together so that we could show folks how it nested with what the division was doing and even other districts, as well as the states, because a lot of people were confused as to all the state's requirements. How does that work? So we had to put together a plan to show how this nested and what it really meant. And this was posted or hung on our intranet site. And I think, again, it was really helpful in allowing folks to see what the plan was. So once you got the plan, the key was communicate, communicate, communicate. And I put that in there 3 times because in a normal work way and face-to-face, it's important to communicate. But when you're doing things remotely, the communication is probably even more important than it was when you can see folks face to face. And we did that via multiple different tools. We went through and did Skype meetings. Before we entered another phase, we would have a WebEx, or actually a YouTube town hall, where we'd communicate those things. So we had multiple different platforms from multiple different people. They were talking the same message, and then they were out there and in front of people pretty much on a weekly basis, updating folks as to what was going on and what we were doing. We provided PPE, so masks, wipes when you could get them. We modified our building with our filters, also with the blown capacity. So again, all of the CDC requirements. And then, you know, sort of the new way of executing virtual meetings, where we set up web meetings with folks. We would do check-ins, so both internal and with external customers. And then onboarding, I put this on there. There was a number of ones that I'm sure you struggled with, but we hired people and then we had to bring them in. We still had to do some face-to-face onboarding because we do fingerprinting. Our CAC cards are still requiring face-to-face. But then we would assign a virtual buddy, and they would have daily check-ins with the new employee. And so that was sort of a way to virtually onboard someone and help navigate them through. And they would do a check-in each morning. All right, and so the future. As I showed you, we are still only in phase 2. Our phase 4 is when there is a vaccine and that everything can go back to normal. What I think you'll see, and we've been collecting some lessons learned, nothing has been formalized yet, but the core has always struggled a little bit with embracing using telework. But what we've shown through this pandemic is that we're able to execute at pretty much the same level as before while on max telework. There's still an element, I think, of face-to-face that we'll still have to have, but the future I would envision would be a lot more of what we're doing with a little bit more face-to-face. Now, is that going to mean that everyone can work 3 days a week from home? I'm not sure the number yet. That's what we kind of going to struggle with a little bit as to what that right looks like. But I can tell you one of our lessons learned is that telework does work, and we can make it work because of the people that we have. And then the other one is just reliance on the tools like this WebEx. I think these have been a great thing, something that was underutilized in the past and can help save time and money being able to set these up. So that's all I have. Gwen, I'll turn it over to you.
Okay, well, thanks, Mike. Interesting how similar our experiences have been. So I'm going to first thing I'm going to do is try to advance my slides. Jay, I'm not seeing a way to advance them. Okay, never mind. Now I see it.
There's
Okay.
a bit of a lag there.
There we go. Okay.
There you go.
So Jay had asked me to talk a little bit about the CDM Smith COVID journey, and then talk a little bit about what I thought might be some best practices that we extract from this experience. So let me start by just giving you a quick snapshot of what perspective I'm sharing with you. I speak from the perspective of an AEC firm that is about this size, with this many offices, this many employees, and is employee owned. And we really work across a wide variety of markets, as you can see on the left, the sorts of services that we provide there in the middle, and then the client sectors that we serve over there on the right. So how did we respond? Well, really the entire response experience very much mirrored what I was accustomed to working both in the military and in support of federal agencies when it comes to disaster response. The first thing you have to do is you have to establish a response team. Who is going to assess the situation, develop courses of action, evaluate those potential courses of action, decide on what's most important that will serve as your decision criteria, make a decision, communicate the decision, and then put that decision into action plans. And so I got to participate as part of our corporate response team, which comprised of our chief operating officer, who chairs it, and is represented by the directors of HR, Office of General Counsel, Director of Logistics, Director of Finance, and Director of Public Affairs. And so we basically went through the decision, or the disaster response decision cycle, and established our priorities. And I'll talk a little bit more about those, but in short, it was people first. Do what we need to do to make sure that we preserve the health and safety of our staff. Next was develop a rhythm. And Mike talked a lot about communicating with staff, over-communicating initially to make sure that everybody understands what's going on, what it is we're trying to accomplish or preserve. Another component of this is really what I call micro-monitoring the health of the organization. Are you still getting the mission done? And how do you know that? And do you have to monitor on a little bit quicker cycle than what you had been before the crisis? And then you have to have a way to capture lessons learned as you go along, because I think most of us understood enough about the pandemic during the early days and weeks that those who are professional epidemiologists were forecasting that this is just the first of maybe many waves. So we need to know, were the things that we were doing now and implementing the right things, because we might have to repeat them again during a second or a third wave. And then finally, somebody, at least a couple of folks, have to keep an eye to the future. Most folks are going to be kind of head down, trying to survive the crisis, get through their days, get through their weeks, deliver on those 5-meter targets in front of them. But you need at least a couple of folks who are thinking out into the future about, what does this all mean to our future? How is our business, how is our market, how are our clients going to change as a result? So our response team really coordinated all of these efforts on a daily basis, in addition to doing their day jobs. So CDM Smith's return to office plan. So let me start by saying on March 16th, the response team made the decision to send everybody, 100% of our workforce, into a work from home, with the exception of those active construction projects. And we had a whole separate protocol for adjusting the health and safety plans to allow those activities to continue. Those were deemed critical infrastructure projects, so they were allowed to continue based on the CDC guidance and most of our state guidelines. For the rest of the workforce, almost 5,000 folks globally, the next day went to a work from home situation. They were allowed to come back into the office, grab their monitors, their extra monitors, postage machines if that was part of their activity, their duty, what they needed, take it home. And again, establish, like Mike talked about, establish that home office. Get yourself up and operational as quickly as possible. We have now started to transition into a return to office. And just like Mike talked about, we have 3 phases of reopening. The first phase is really intended to allow just limited activities to return back into the office. And we've defined those as those activities that are materially enhanced by that face-to-face engagement or interaction. Examples might be onboarding of new staff, supervision of junior staff, those in the less than 12 months with the firm right out of college that need some direct supervision. Or it might be for a project team to come in and review a critical milestone before the deliverable is sent into the client. Or it might be a large complex proposal that really is improved by direct face-to-face coordination and collaboration. And so very limited numbers, very low attendance in phase one. But in order to bring people back into the office, there's a whole lot that has to go on behind the scenes to prepare for this event. And our director of logistics managed this in concert with our response team. Everything from working with the landlords, again, 130 offices globally. We have to get out standards and expectations to our landlords through all of our lease agreements on what we expect the HVAC system to have done, to have potable water systems flushed if the buildings have been empty for a couple of months, just to make sure that the building was safe to habitate. And then, of course, your staff are going to experience a different experience, new enhanced protocols, sanitation and hygiene, mask wearing, social distancing. Our phase one has a limit of no more than 50% occupancy, but just as Mike mentioned, we saw very low numbers coming back to the office. We made it 100% voluntary to come back during phase one. And again, just those folks who needed to do those very limited activities. So phase two is as the office has been open for, we said 30 days, and has been able to demonstrate that their supply chain for all those hand sanitizers and reusable masks and cleaning products, the supply chain is there. We're confident in it, and we can get resupplied as we let more people into the office and have higher demand. That the staff who have been showing up to the office in phase one are in fact demonstrating the behaviors that we need. So we know everybody gets it. They've been trained and they're modeling the behaviors that we need for a safe work environment. And the last part was the tricky part, to decide when to go to phase two. And that was really looking at the transmission trends, the positivity rates in that office location, and trying to determine if we felt it was safe to bring more people back into the office in that office. And that's a tricky decision to make, because there's all sorts of information feeds that you can use to inform that decision. We chose 3 websites that showed a snapshot of what that geography looks like, and you can get a state level, and then you can actually burrow down to a county level to see are they red, amber, green? Are they trending in the right direction or in the wrong direction? And ultimately make the decision to allow a greater number of folks to return to that office. And then finally, like Mike and the Corps of Engineers, our phase 3 is triggered by when there's a widely available vaccine that protects everyone, and we feel that we can go back to more normal operations. So here's a quick poll. Many of you are accustomed to working in an office and now have transitioned to home. Do you prefer working from home or an office setting? I had a couple pictures up there. We've seen just the full gamut of what a home office can look like, from that picture on the left, which is be pretty nice, to the picture on the right, where folks are setting up a little tiny desk and chair next to their bed, or in a spare bedroom. And some of us may have kids in the house. We've got other distractions, other people in the house working from home that might be sharing our internet bandwidth. So so here's the poll results. Jay, it looks like the overwhelming majority is, yeah, I love it. I've transitioned to it, adjusted to it, and it fits my personal preferences. And then still a good chunk of you all that would like to get back into an office setting for that routine, for that reliability of routine, and maybe lack of distractions. So certainly understand that. We've heard a lot of the same thing from our employees. Okay, just a little COVID humor here. Got to stay sane. And probably my favorite one right here. Yep, you got to have the cleaning supplies. So this is what CDM Smith looks like today in terms of who's gone back to the office. And you can see on this map that that our Middle East and European offices are a bit ahead of us in terms of percentages of folks that have returned to the office. Quite frankly, their transmission rates have been significantly lower than many of the places in the United States. So the US is going low and slow at this moment. Okay, so let me shift gears and talk about just some observations that I would put into the bucket of what we think might be best practices for this COVID response. We only have 4 months of data, not a whole lot, but here are my thoughts. So first, let me define COOP, or continuity of operations, from an AEC firm perspective. And the way I define that is you need to be able to continue to do the work, execute your backlog, that work that you have under contract and in hand. Our clients are under stress, and we need to ensure that we continue to meet or exceed the client's expectations so that we don't add to the stress. You need to continue to replenish the backlog and win work. Really, the one thing that'll cause Joe to your left or Susie to your right the most stress is the fact that they don't know what job they're going to be working on next, and they start worrying about job security. So you have to continue to keep winning work. You have to continue to replenish the backlog. Cash flow. You have to continue to get paid for the work. You have to be able to bill, invoice, and collect on those payments. You know, one of the things we're seeing in our municipal sector of our business is that many cities and states are now starting to become cash strapped. Their revenue streams have been significantly decreased, and they are conserving. They are starting to delay or cancel capital improvement projects. And so all of that has an impact on our revenue stream and may even cause some impacts to cash flow. So you have to stay on top of that. People will continue to retire. They will continue to transition. They will continue to graduate from college and expect to be hired by someone. And so your recruiting cycle does not stop. And I might talk a little bit about some of the challenges with onboarding in a virtual environment. You know, how do you do that? How do you indoctrinate that new individual into your specific firm or organization's culture and get them off to a strong start? How do you feed work to them so that they feel productive on a daily basis right from the beginning and avoid that sort of stress of not being utilized? And then finally, again, some part of the organization, some people have to be tagged to be focused on continuing to look towards the future. And what does all this change mean to us? How will we run our organizations differently? How will we lead our organizations differently? How will they be shaped differently in terms of staff and organizational structure? What new tools do we need? So we need to keep looking to the future. Okay, let me talk a bit about operations and in terms of best practices or reflecting on lessons learned. We adopted a term called micro-monitoring. And I think that sounds a lot better than micromanaging. Nobody likes to be micromanaged. I certainly don't like to. But I think this term micro-monitoring really captures the idea of having to continuously and frequently check in on those key performance metrics of your organization and know with confidence that the organization continues to deliver on its promises, that it continues to operate in the healthy zone. And so where in the past you may have been monitoring these performance metrics maybe on a monthly basis, now maybe you're looking at them on a weekly basis or even a daily basis. But I think that frequency gets accelerated or increased. And I think the decision cycle as a result of monitoring those performance indicators becomes compressed and faster. You have to be able to know that something's going off the rails early so that you can take corrective action before the train crashes. So we've adjusted in that way, and I think that was a wise move. Okay, so a poll question here. So what has been the most significant COVID impact on your business or agency? Is it UT pressure, utilization pressure, causing some angst Could even be impacting employee morale. If you're in business development and you're accustomed to traveling to see clients or meet with business teaming partners, and that has been curtailed or canceled altogether, how are you coping with that? Certainly, our workforce has expressed concerns about challenges from working at home when they have school-age children that have been out of school for months now and may not be going back to school for quite a while because their school district has gone to distance learning or online learning. So what are you feeling? What are you seeing?
Well, it looks quite overwhelming that inability to travel and meet with clients is a consideration, and then slowing sales and some productivity impacts.
Yeah, so it sounds like maybe we have a lot of business development folks listening today, because I do think that inability to make those client connections and maintain strong relationships with your client, meet with them face-to-face over ongoing work, or to make connections across our business community, teaming partners. Yep, it's all, I think, had an impact on us. Okay. All right, a little bit more COVID humor. Okay, so one of the first decisions I think a response team needs to make is to define what's most important in this emergency situation. And in my firm, we quickly came to the decision that employee health and safety was going to be paramount. And so we adopted this people first philosophy. And let's face it, our firms and our agencies are really nothing without the commitment of our employees. So we're an employee-owned company, and our workforce truly is our engine of ingenuity as an AEC firm, as well as a sole source of financial investment for our growth. So on March 16th, we decided to place everybody on that work from home and really hone in on the message that we are putting you first above all other things regarding the business. And that kind of leads into your culture. Now that you've sent everybody to work from home and we're all in this isolated or decentralized environment, how do you retain your company culture? You know, that glue that really binds your team together, that sense of identity, that extra motivation that makes your teammates willing to go to the mat or go the extra, put in the extra effort for you when needed. So we put some thought into this and developed a multifaceted plan that really would help keep that glue amongst each other. One of the tools that we had already in place that really came in handy was we have an internal social network tool called Yammer, and it allowed us to set up channels where we could have discussion topics. What's it like how are you coping with working from home with school-age children? Share your experiences and your best practices. What does your home office look like? Especially if you think it's kind of funny, share that and let everybody know how you're staying sane. But it was things like that, just like Mike talked about, the social events, the happy hours, the virtual happy hours, anything helps. But I think it's just a recognition that you need to do these sorts of things, that it won't happen unless you take proactive steps. I need to take a second and really just applaud the heroes, I think, during this work from home experience. And that is every chief information officer or director of information technology out there. I will applaud ours for being both a visionary a couple of years ago, as well as a hero once we hit the button to send everybody home. We went to Microsoft OneDrive for all file storage, cloud computing. We got everybody off of local servers, so we didn't have that risk hanging over our heads of something going offline and nobody being able to do anything about it because no one was in the office. We went to Microsoft Teams about a year ago, and although everybody, kicked and screamed a little bit because we were comfortable with Skype, we made the transition, and I think we've all found that the enhanced capabilities have been worth the while. And then lastly, our IT support team, or what you call a help desk, they completely shifted gears and focused on the idea of optimizing home networks. If you were struggling in any way, shape, or form with getting yourself set up and optimizing your bandwidth and your connectivity, that was absolutely a reason to call the help desk, and they were fantastic. So hats off to all the IT professionals out there. Okay, last thing I want to talk about here is your clients. You know, if you're an AEC firm, you're probably asking yourself over the last couple of months is, what's changed in their world? What do they need right now? Mike talked about that first week after the Corps of Engineers went to work from home and they realized the VPN system couldn't support it. And I heard a couple of examples of working with our Corps of Engineer clients, and we said we'll set up the Teams meeting. You call in on your cell phone and we'll set up the Teams meeting or run it off of our backbone until you're up and running. Little things like that, just show partnership and that we're kind of all in this together. But then I think there's new opportunities that have come out as a result of the AEC being asked to serve our nation in this COVID response period. So what are you seeing? I'd like to hear some of your new opportunities.
And if folks can type those in the chat room, I could summarize.
While you're thinking about that, let me give you two examples that come to my mind. So CDM Smith helped the Corps of Engineers in one of their unforecasted new missions, and that was to be able to mobilize the Corps of Engineers to help identify, design, and build these alternative healthcare facilities. Our project in this example was a small facility up in Montana. That was a children's hospital that had some floors that were not being occupied at the time, were not being utilized, and we transitioned those into temporary medical facilities. And then another example, which I think is really pretty cool and really speaks to this engine of ingenuity that exists in our companies, we developed a capability that could rapidly determine if there were COVID markers in the wastewater streams. And we have sold this concept, this capability to several of our municipal water utility clients and to USAID overseas in Jordan. This really allows a community to have about a 7-day early warning that COVID is spiking in a community and gives them some additional time to prepare to respond to it, either to put everybody on lockdown or to prepare the medical community for a surge. So, Jay, what are some of our responses?
So some of the opportunities folks are thinking of are the potential for screening, protection, and tracing technologies to be employed in our industry. And then the ability to be a part of the conversation to forecast what the future of work will look like. And then opportunities related to HVAC and protection, whether it's through filtration, use of UV, or other type treatments.
Yeah, I've read quite a few articles on all those, so I do believe all those are part of our next wave of opportunity to serve the nation. Okay, so new normal. Last thought here. We start to think about how is our organization going to look and feel different in the future? Mike talked on this. Remote workers, more full-time remote workers or part-time remote workers. How do you know? You could take a survey 2 months ago and you'll get, I think, a certain set of answers. You could take a survey today. You might see sentiments start to change a little bit. You could take a survey 6 months from now and things maybe are starting to feel a little bit more normal and you might get a different answer. And how do you plan for that sort of kind of an evolving sentiment? And you have to be careful that you don't plan based on something that is not really permanent, but likely will change as things get back to normal. Leadership, if virtual leadership becomes the norm, what does that mean for managers and leaders in an organization? What sort of techniques do you have to start to develop in them to be an effective virtual leader? Business travel, I mean, maybe we figured out that we can live without some of the reasons for business travel and take that cost as a cost savings. And office locations. You know, the large cities have been hit hard. Workers are reliant on public transportation to get into the office. Is the downtown heart of the city the best place to put an office these days? Or is it more suburban, where folks can drive a personally owned vehicle to get in and out of the office and not have to get on a train? So these are all sorts of questions that we're kind of wrestling with right now. Okay, just kind of wrapping it up, I think the one thing that we're all certain about is that there is a lot of uncertainty in our future, and we're all trying to do our best to read the tea leaves and prepare for what the future looks like. But I think there are a couple things as an AEC community, both industry and our federal agency partners have to do. And one is we have to remain focused on leading our teams through this change, supporting our clients through their recovery efforts. There may be large stimulus funding that comes down the pipe over the next couple of years. Every one of our agencies is going to be overloaded with requirements, and so we need to be ready to handle that workload. And then finally, adopting, maintaining a partnering attitude as both industry and federal agencies move through this uncertainty. That's the only way we're going to get it done and continue to serve the nation. So Jay, I'll turn it back over to you for any questions that may have come in.
Gwen, thank you. And Mike, thank you. We have a couple of minutes for questions. Let me summarize several that relate to the decision-making process for getting back to the office and how we incorporate a risk assessment to personnel that based on age, other health considerations, without violating laws such as HIPAA or age discrimination.
Mike, you want to take that first?
Sure. So, I mean, quite frankly, that's probably the toughest decision that, you know, government consulting companies struggled with. And for us, what I'll say is we did that survey, so we had an idea of what people struggled with. But at the end of the day, we didn't question them. And we really relied on each individual to make that. It's a personal choice. And I think what we found is this pandemic has hit people in a lot of different ways and caused people to really think about what's important, how they interact, and just taking risks every single day. And so the only thing we said is, hey, just make sure whatever risks you're taking in your personal life are commensurate with everything else you do. Outside of that, we are not going to then make a value judgment on whether that's right or wrong. And so we said, hey, here are our ceilings to come back. You don't have to. If you are not willing or able to, just tell your supervisor. And as long as you can execute it, we didn't question it. So we just put that latitude on the employee. And quite frankly, that's the only way we could kind of get around that without speaking to everyone's doctors. Same,
to be blunt, same. It's 100% voluntary right now to come back. We ask folks to assess their own personal health, and if they have a family member that might be high risk category in the home, they have to consider that too. Can they afford to get on a public train and commute into an office and then come home to a husband or a wife or a child that may be in a high risk category? So we've made it 100% voluntary, and we will for quite a while. Follow CDC guidelines. That's essentially what we're doing.
Mike and Gwen, I really appreciate your help and interest and the entire audience, the level of participation. We had 156 participants, and I have to give a virtual applause, round of applause again to Mike and Gwen. And then a big thanks from the entire Resilient COI. All the questions that have been queued up will be answered. There are a few that I did not summarize that will be answered. And I'll turn it back over to Mel for any closing thoughts here. Well, the handouts are available. I know we had a couple of potential PDF issues with the handouts. We'll take a look at those. There are PDH credits, and I see the one question regarding AIA. certification for this, and we'll get back to you on that, Paula. So again, on behalf of the entire Resilient COI and SAME, thank you, and enjoy the rest of your Tuesday afternoon or morning, wherever you
Sorry
might
about
be.
that. I couldn't get connected. It's just Tamel here.
Thanks, Tamil. Any
Not a
closing
problem.
thoughts?
So sorry about that. Yeah, just a couple things. If you're having issues getting the PDH from the handout or the presentation, you can send me an email. Here, I'll drop that in the chat right now for everyone to view at the bottom. But it is tharbison@same.org. And I just put that into the chat so everyone can view. Also, our next national event is the 2020 Virtual Small Business Conference held November 4th through the 6th. And you can view details of that conference at www.samesbc.org. And with that, thank you again, Mike and Gwen and Jay, for presenting and moderating for today's session. And thank you for all the attendees for joining in today, and enjoy the rest of your day.
Thanks, Tamil. Mike and Gwen, thank you again. Really appreciate it. That was fantastic.
You bet.
A lot of good feedback.
Thanks, guys.
All right. Thank you all. Talk to you later.
Take care.